definitions of infertility differ. Demographers tend to define infertility as childlessness in a population of women of reproductive age, whereas the epidemiological definition refers to trying for or time to a pregnancy, generally in a population of women exposed to a probability of conception. 4. The time needed to pass during which the couple tries to conceive for the couple to be diagnosed with infertility differs between different jurisdictions. Existing definitions of infertility lack uniformity, rendering comparisons in prevalence between countries are over time problematic. Therefore, data estimating the prevalence of infertility cited by various sources differs significantly. 4. A couple that tries unsuccessfully to have a child after a certain period of time, often a short period, but definitions vary, is sometimes said to be subfertile, meaning less fertile than a typical couple. Both infertility and subfertility are defined as the inability to conceive after a certain period of time, the length of which vary, so often the two terms overlap. The following causes of infertility may only be found in females. For a woman to conceive, certain things have to happen. Intercourse must take place around the time when an egg is released from her ovary. The systems that produce eggs and sperm have to be working at optimum levels, and her hormones must be balanced. For women, problems with fertilization arise mainly from either structural problems in the fallopian tube or uterus or problems releasing eggs. Infertility may be caused by blockage of the fallopian tube due to malformations, infections such as chlamydia and or scar tissue. For example, endometriosis can cause infertility with a growth of endometrial tissue in the fallopian tubes and or around the ovaries. Endometriosis is usually more common in women in their mid-20s and older, especially when postponed childbirth has taken place. 28. Another major cause of infertility in women may be the inability to ovulate. Malformation of the eggs themselves may complicate conception. For example, polycystic ovarian syndrome is when the eggs only partially developed within the ovary and there is an excess of male hormones. Some women are infertile because their ovaries do not mature and release eggs. In this case, synthetic FSH by injection or clomid-clomiphene citrate via a pill can be given to stimulate follicles to mature in the ovaries.